Good afternoon. This is Dio. I want to take you through the calculation of IV drugs. In short, IV drugs calculations. So these drugs are drugs we administer through IV. Remember, there are so many ways of administering drugs. Okay, you can administer drug IV, you can administer drugs IM, and you can also administer drugs subcutaneously. Okay, these are some. So IV drug goes direct into the veins, IM drug goes directly into the muscles, and subcutaneous into the subcut or subcutaneous layer of the skin. Now, today I want us to focus on how to calculate drugs using the IV route. Okay, so the formula we have. The formula is simple. For every drug you want to administer, you should be familiar with the formula. What's the formula? The formula is doctor's order, which will be obvious as DO, over or you divide by the available stock or strength times the particular volume of the drug. Okay, so it's a very simple formula. I hope you enjoy. So let's look at some examples and see if we've understood. Remember, doctor's order divided by the available stock or strength times volume. Okay, then you can withdraw the amount of drug you want to give. Let's look at a few particular examples to cement on our understandings. Okay, so we look at this example. Number 1. Mr. Felix has been prescribed of 2.4 mega of drug X. Okay, for injection. The available strength which you have is 5 mega in 10 mils. How many mils are you going to administer to Mr. Felix? Okay, so let's go with the formula as usual. What's our formula? Our formula is doctor's order over the available strength times volume. Okay, so what's our doctor's order from this question? The doctor wants us to give 2.4 mega. Okay, so our doctor's order is 2.4 mega. And what's our available strength or stock? It's 5 mega. And what's our total volume? Our total volume is 10 mils. Okay, so let's replace them in our formula and see what we come up with. So what's our doctor's order? It's 2.4. Remember the units every time. 2.4 units mega. Then we have the available stock, which is 5 mega. Okay, then you multiply by volume. Okay, what's our volume? Our volume which we have there is 10 mils. So we will replace it with 10 mils. Okay, now if we follow critically, we are going to divide, cancel out the units. Units goes. We are going to remain with mils. Okay, so 5 there, 1. 5 into 10. 5 into 10 there, it's 2. Then when we apply 2 times 2.4, our answer should be 4.8. 4.8 mils. This is what you are going with to withdraw. So from the total volume of 10 mils, you are simply going to take out 4 mils for Mr. Felix. Let's look at another example. We have another example here. A patient has been prescribed of 2 milligrams of pethidine. Okay, so we want to give the patient 2 milligrams. This one here. Okay, now this 2 milligrams of pethidine for injection, the stock strength which we have with 10 milligrams. How many mils do you give the patient? Okay, let's write again our formula. Doctor's order over the available stock or strength times volume. If we replace our values there, we are going to have 2 mega over our variable strength, which is 10 milligrams times volume. If you look at our volume here, our volume is 1 mil. Okay, then milligrams cancels. Okay, 2 there, 1, 2 there, 5. If we calculate here, we are going to observe the answer will be 0.2 mils. Okay, so from the total amount of 1 mil, you are going to withdraw 0.2 mils and you are to administer to a patient. Okay, hope you are understanding and enjoying my presentation. Let's look at the next example. Mr. Msiwa, a 45 years and weighs 70 kg. He needs to be given 3 mg of morphine, which comes as 10 mg in 2 mils. How much do you draw up? How much are you going to give to Mr. Msiwa? Okay, very interesting question. Now, what's our doctor's order? Doctor's order, of course, over variable strength times volume. Okay, now what's our doctor's order? Our doctor's order, it is simply the doctor wants us to give 3 milligrams of morphine and our variable strength, which we have with C, 10 milligrams, and the total volume is 2 mils. So here there is no need of using kgs. It's just a distractor. Okay, so let's concentrate on what we have. So what's our doctor's order? Doctor's order, as usual, is 3 milligrams. So we write down here 3 milligrams. Then we are going to divide by the available stock. What's our available stock? It's 10 milligrams times 2 mils. Okay, then milligrams, because we are going to remain with mils here. Okay, we'll remain with mils. Then we are going to cancel out. If you divide there, the answer is going to be 0.6 mils. So Mr. Msiwa will receive 0.6 mils of morphine. Okay, very interesting. Hope you are understanding. If you have any question, drop the comments below in the comment section. Let's look at the other question here. The other question is for Mr. Kennedy. Mr. Kennedy 2019, that's the name, has been ordered 80 milligram of tramadol hydroxide for pain. On the words, you have 100 milligrams in 2 mils. Calculates the volume to be administered. Very simple and straightforward. Okay, so what's our doctor's order? As usual, our doctor's order, formula over the available stock times volume. So our doctor's order here is this 80 milligrams. And what we have is 100 milligrams in 2 mils. That's our volume. So let's replace in our formula there. Okay, our doctor's order is 80 milligram. Then we are going to divide by our available stock. What do we have in the word? So in the word, then we multiply by our volume. What's our volume? 2 mils. Okay. Then, of course, milligrams, because we are going to remain with the mils there. Okay. Then, if you divide, we are going to observe that, okay, 0 goes, there it's 1, there it's 5. Okay. 5 into 8, we are going to have 1.6 mils. So you are going to give Mr. Kennedy 1.6 mils of tramadol hydroxide, which is an analgesic drug, or it's an analgesic for pain relief. So thank you very much. Let's look at the last example. The last example, it's here. Example number 5. So on this example, we are saying 40 units of insulin has been prescribed. It is dispensed as 1,100 units in 1 meal. How much do you give? Okay, very interesting question. Hope you are understanding and enjoying my presentation. So, of course, let's write down our formula. So our formula is doctor's order, of course, over the available stock or strength times volume. Then what's our doctor's order? Our doctor's order, let's replace them in the formula. Our doctor's order is 40 units. Now these 40 units we are going to divide by our available stock. What's our available stock? It's 100 units times volume. What do we have? What's our volume? Our volume is 1. It's 1 mil. which is 1 mil. Okay, then you are going to divide units goes, then you are going to remain with a mil there. Okay, 0 and 0 goes, then 10 into 4 into C, 0.4 mil. Okay, this is what you are going to administer to the patient who needs insulin. So thank you very much. Hope you have understood, and I'm hoping to see you again. Please, if you are watching this video for the first time, subscribe to our channel and you'll be receiving some notifications as we post some new videos. Thank you very much. See you.